Good afternoon, everyone. I am Dr. Anushri Kadukar, MD Rasashastra, and a proud member of Gurukul Global Academy. It is my honor to welcome you all to the first clinical meeting of Gurukul Global Academy, a unique platform dedicated to Ayush doctors and all the health education faculties. This academy is visualized as a center of excellence where traditional wisdom meets modern academic standards. Here, every course, every training, and every program has been designed to empower Ayush doctors with knowledge, skill, and global exposure. We strongly believe that Gurukul Global Academy will not only enhance academic learning but also serves as guiding light for future generation in the field of Ayurveda, Yoga, Unani, Siddha, and homeopathy. I extend my heartfelt gratitude to all the dignitaries, teachers, and students present here. Together, let us take a step forward in creating a future where Ayush shines globally. And now I warmly invite everyone to come together and offer our prayer through the Dhanvantari Stavan.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मम् लोके जरारुक् भयमृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुदं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
Thank you, everyone. Now I request Dr. Datta Papardikar sir to proceed further with the session.
Thank you, madam. Please allow me to share. Okay. So welcome you all. Let me introduce the Gurukul Global Academy. We have the mission of building the future of healthcare. We provide 25 plus super specialty courses in Ayurveda with integration of Ayurveda and modern science. We run clinical meetings for Ayush doctors. We also do workshops and hands-on training conferences regarding Ayush and Ayurveda. Let me introduce our today's guest speaker, Dr. Rajnikant Patel, sir. Sir has done B.A.M.S from Atre Ayurvedic Medical College, Bangalore. Sir is Chief Physician at Agnivesh Ayurved Hospital, Surat, Gujarat. Gujarat. Sir has treated more than 1,500 cases of mucormycosis, which has taken featured in BBC News for successfully treated with Ayurved treatment. Sir has published 8 plus research publications. Sir is also associated with Jiva Ayurveda and Easy Ayurveda. So our today's topic is management of spider bite in Ayurveda, a case study, Luta Visha. I request sir, please proceed.
Thank you, sir, for the warm welcome, and it's my pleasure that Gurukul Global Academy has invited me to speak a few words here on the Luta Visha and the Ayurveda case report. Okay, so my voice is audible, no, sir? Hello.
Yes, sir, audible.
Yes. Yes. Okay, so we can proceed. Next slide. So this is my hospital, Agnivesh Ayurved Hospital at the Surat. We have 15-bed hospital, and we do deal with almost all the fields related to the diseases. So next. I strongly believe that the thousands of years of human observation and trial and error are always greater than the 6 months of great experiments in the lab. So what we are seeing currently in the conventional science, they are doing some in vitro, in vivo study, and they will do some 4, 5, 6 months, 1 year experiment, and they will apply it on the whole world that this medicine is working and all these things. But whereas if we compare this thing to Ayurveda means our Acharya has observed thousands of lakhs of patients, and it is the knowledge of generational traditional. I mean the generational knowledge it is, and whatever the conclusion was there that they have written in the form of Samhita like Charak Samhita, Sushruta Samhita, and all these things. So it is far more greater than the current research or the current experiment what the conventional science or the modern science is doing. So we must respect our Samhita and Shastra. So the day we start respecting and understanding our Samhita and Shastra, the treatment of any disease becomes very easy. When we don't understand the Samhita or Shastra, or we don't have enough respect what is written in it, the chances of getting results or chances of becoming successful Vaidya becomes very less. So I strongly believe this that thousands of years of human observation and trial and error are always and it will be the greater than the current lab experiments of the conventional science. Next. So when we read the Charak Samhita Chikitsa Sthana in the Vish Chikitsa, Acharya Charaka has mentioned the characteristic of identifying the various kind of Visha. Mostly he deals with the snakes and all the species of snakes and how to identify whether it is bitten by male snake, female snake, all these things they have mentioned. But regarding different animal and different all these things, he has mentioned in one or two line of sloka like dog bite, all this insect bite, all these things. So in the 23rd chapter, 144th sloka describe about the characteristic of a person who is bitten by the spider. So he says that Damshasya Matye Yat Krishnam Shavam Va Chalaka Avrutam दग्ध आकृति वृषम पाकी क्लेद शोथ ज्वरान्वितम तुषि विषाभिः लुताभिः तथा दृष्टमिति निर्देशित. So the bite or the place which will be the black or blackish in the center, covered with a net of veins, you can see in the photo. The patient will be having the burning sensation over that area. You can not see this, but patient was having the burning sensation in this specific case. Inflammation is there, swelling is there, fever was there. So all these things, what the shloka says, what the Acharya Charaka has written in his Chikitsa Sthana about a Luta Vish, the same presentation I got into the clinical practice. So here you can, or this can be considered as a Vishaj Shotha also, because if we see the Samprapti and the Lakshana of Shotha, so there we have the Utseda in between the Rakta and Snayu and Mamsa, Tvacha and Mamsa, right? So this is the Utseda. In Shoth also we have the Shira Ayam. So Shira Ayam can be seen here. Jalakaruta is there. So this case either can be treated with the Luta Vishitikitsa protocol or it can be treated with Vishesh Shotha protocol also. But in this case, I will be discussing about how I have successfully treated this case with a pure 100% Ayurveda treatment and not a single modern medicine were used in this particular stage. So this is confirmed for us that we have the reference in Charak Samhita about how we should identify the Luta Vish, and the same thing what Acharya Charaka has mentioned is visible in the clinical presentation of the patient, right? So this is the identification or the opening remarks of the Luta Vish in Ayurveda. Next. So the brief history, if we talk, he was a 23-year-old guy, and he came with a complaint of a heart swelling on the right arm area, burning sensation, and the skin or the area which was very much hard. It is like a stone with a pain, reddish discoloration of affected area, reddish line-like appearance, and this presentation he was having since 1 week. Now, interestingly, he was operated for the same condition in the same upper limb at a different site, but this is reoccurred for the third time, and then patient came to Ayurveda. So, in the first time, I think he was having the same presentation on this area. They have operated and it was relieved for temporary. Again, it was relapsed nearby this area, right? So second time also it was operated and got relief for temporary. Now third time it has appeared on this area, as you can see in the photo in the previous slide. So now the patient got fear that if I go to the operation from here, now where it will go, whether it will go to the lungs, whether it will go to the backside or spinal cord, or whether it will go to the brain or where. So then they think of Ayurveda to take the help of Ayurveda, because they were knowing that they already underwent for one surgery. It was relapsed for second time. They underwent for second surgery. It relapsed for third time on this same arm. So now patient comes to Ayurveda. So we will see the previously two times what they have operated and what are the brief of those conditions. Next. So this is the first discharge summary where he was operated. So you can read into diagnosis that right side forearm cellulitis with superficial thrombophlebitis, right? So this is the first discharge summary. And operation, you can see the surgical surgery done by the Dr. Vijay Kanani on the 15th of February 23. Next. And this is the second surgery. You can see the diagnosis. They have not they have not mentioned the spider bite or all these things because they were not sure about whether this case was due to the spider bite or not. Later on, we have taken the deep history of the patient, and then we confirmed that all these things he was having is due to the spider bite. But they were not able, they were not confirm or the pakka to say this is the spider bite. So they were saying it is a forearm cellulitis. So this is the second time he was operated for the recurrent right forearm cellulitis on 25th of March, right? So this is the second discharge summary. Next. So on 13th of February, when he was presented with the first time, his MRI right forearm was saying that forearm cellulitis with subcutaneous infective collection on the dorsal aspect, and for the same, he was operated on the 15th February, that is 2 days later of the MRI scan. Now again, it was presented with the same thing in the same upper limb on the 22nd March, and the MRI shows that subcutaneous edema with inflammatory fluid involving the deep subcutaneous plane of the forearm region, particularly along with the posteromedial aspect. And again, for this, after 3 days, he was operated. Now, the same symptoms, everything is now reoccurred for the third time, and the patient came to Ayurveda to seek any help, if possible, to our hospital. Next. So, patient came for the Ayurvedic treatment as he and his family member or and the parents were not ready to go for a surgery. So what happened in the first and second, especially in the second time when this was relapsed, the doctor in the hospital, they were trying to find the cause, but they couldn't find any cause of this issue. But once the surgeon told that, the surgeon had an opinion that the dead tissue under the skin, when he opened the skin, when he started the debridement of the affected area, The skin is clearly resembling like a case of any insect bite, but he was not sure about which insect bite. But according to his experience, majority of the insect bite cases has such abscess or such cellulitis developed, right? So when we ask the patient that you remember anything, you went to the farm or forest or village where something has bitten on your hand or not, so he was saying no, nothing is bitten to me. So when we asked that, have you seen any different kind of insect or anything in your home or in the place where you work? Because you were saying he hasn't traveled anywhere in the forest or farm or open area. He was continuously working regularly. So we were having confusion that what exactly this is. So in this conversation, he said that, oh yes, sir. One day I have seen the very big size of spider. With it is a very special variety of spider, and the spider was having thorn on his leg. Right in his shop, he has seen, but he was not sure that whether the spider has bitten him or not. And that spider is not known to be present in the Gujarat, Rajasthan, Maharashtra, Madhya Pradesh state, and they have confirmed this with the expert of this insect, all these things they know. So they say that the spider, which he has seen, and he has the photograph of the spider in his mobile phone. And I think I have kept this in this slide also. If it is there, we will see. So the majority of the expert has the opinion that the spider which he has captured in his mobile, I mean photograph in the show, it is mainly seen in the China and all this thing region. Now, interestingly, the patient was involved in the embroidery business, and he frequently order material, all this thing, raw material from the China in the container, and he himself go and unload the truck or the container to the shop. So it is 99.99% the thing he has kept on his shoulder, and he unloaded the truck. So he put some cloth or something into the shop, and that spider might have run or might have the thorn of spider might have touched on his upper limb anyway. Otherwise, this condition may not occur, right? So this was the history that we got from the patient after in the third time when it got relapsed, right? So this is the brief history, how it was started and all these things. Next. So one more interesting point to note that that we mentioned already in the first slide. Acharya Charaka has mentioned exactly the same symptoms in the Luta Visha, that is the spider bite poison. Damsha Madhye Yat Krishnam Shavam Va Jalaka Avrutam Dadda Avruti Vrushan Paki Kled Shruti Jaramit Lushi Visha Vihi Luta Vish Tatham Drashtamiti Nirdeshit. Right. So based on this finding, we have started the treatment of this patient under the Luta Vish Chikitsa protocol, which is mentioned in by the Acharya Charaka in the Chikitsa Sthan. And surprisingly, just within the 7 days, majority of the symptoms and clinical signs and symptoms were almost resolved. Right? So this is complete cure in the within 7 days, and you can imagine how much money and how much time they have spent in the getting treatment from the conventional science. They did two-time operation. Patient was admitted for 2 to 3 days. That he has to take leave from his business and all these things. If you see, so this is the real strength of Ayurveda. That's why we say we should respect and we should understand the Samhita, what it is written in the Samhita, and we can exactly find a same thing in our clinical practice, right? So this is one such case of spider bite. Next. So treatment given. So I think all the protocol, these 8 protocol are from Charak Chikitsa Sthana only. So Panchashirish ghee, in that time it was available in my hospital. So we have given Panchashirish ghee. It has only Shirish Panchanga and cow ghee. So 1 tablespoon 3 times a day we have given. Shotagna Mahakashaya tablet, 15 tablets in a day. That is divided into 3 doses, 5 tablets 3 times a day. Vishagna Mahakashai, 5 tablets 3 times a day. Keshor Gugulu, 6 tablets, 4 tablets in a day. Tushi Vishari Gulika, 3 tablets 3 times a day. And Shirish flower Soras, 1 tablespoon every 2 or 2.5 hourly we were giving. Then we ask them to apply the paste of Raktachandan, Shirish, Nirgundi, Vidarikan, Tagar, Kushtha, Patala, and Anantmula, and the paste has to be prepared with the swaras of a Sreshmata leaf. And after 1, 2, or 3 hours keeping the paste, we advise them to take a Dhupana of the Tagar, Kushtha, Shirish flower 3 times a day on that area. Right? So this was the treatment. Now, many of you may be wondering the aggressive dose in the prescription, like Sothamna Mahakashai, 15 tablets a day, that is 1 gram tablet. So, Vishagna Mahakashai, again 15 tablets a day, Dushi Visharigulika, 10 tablets per day. So, when we deal with a critical or such condition, where we have to get at least some of the results in 24 to 48 hours. Otherwise, there is a chances of case being getting deteriorated or patient will go to the emergency and they will get operated. So the high dose in Ayurveda is a key to get a success in critical and emergency condition. You cannot treat critical or emergency condition in very less of this dose. So, and this doesn't mean that the patient has continued the same dose. Once we have the satisfactory improvement, we are satisfied with the results. We have decreased the dose to the only 20 to 30% of the actual dose, right? So, aggressive dose is must to treat any critical or emergency condition. Once the patient is stable or once we are satisfied with the good impact of our medicine into the clinical condition, we can reduce the dose. Right? Next. So Panchashirish ghee, as I have explained, the Shirish Fal Mool Twak Pushpa Patrehi Samehi Kutehi Shreshtham Panchashirishu Vayam Vishanam Pravorovate Iti Panchashirishu Agataha. So the 5 parts, that is Panchang, root, fresh root, fruits, barks, flowers, and leaf of Shirish taken together in the equal quantity is known as Panchashiri Shagar, which is the best one for destroying any kind of poison. So Acharya Charak says whether it is Dushi Vish, Gar Vish, Thavar Vish, Jangam Vish, all the Vish can be tackled with simple use of Panchashiri group. And we already know that Shirisho Vishagnanam, Shirish is the best herb to tackle any kind of poison. That we have the reference in the Sutrasthana in Yajna Purushi Adhyay, right? So, and Shirish again is my drug of choice, and we do use the Shirish Churna in majority of the patient because we see all the disease as a result of Dushivish or Darvish in our practice, right? Asthma is there, psoriasis is there, all these things are nothing but the Dushivish, right? So when we add the Vish Chikitsa along with the regular prescription in majority of the disease, we get the significant results. And Shirish is one of the best candidate to use when our target is to treat the Dushivish or Garivish, right? So this is Panchashirish group that we have used in the this thing. And snake poison also Acharya Charak says Shirisha, this Panchashirisha ghee can be used for the treatment of snake bite also, right? Next. Chotharna Mahakachai, as we know, the reference from Tarak Sutra Thana, Patala, Agnimanth, Shonak, Bilva, Kachmaria, Kantakari, Bruhati, Shalparni, Krishnaparni, Bokshu. Iti Swayathu Harani Bhavanti. So Chotharna Mahakachai, why we have used this? There was a local inflammation, edema, I mean the swelling was visible. And in the first beginning slide, I have told you that this case can be seen as a Luta Visha as well as Vishesh Shoth, right? Because in the Shoth also we have the Shira Ayam Samprapti is there, Utseda is there, that is the Pratyatmak Lakshan of Shoth, and this was present in the case along with Ushanata and all these things. So we have used the Shothagna Mahakachai tablet in high dose in initial days. Next. Vishagna Mahakachai, Haridra, Manjistha, Suvaha, Sukshma Ela, Palindi, Sandan, Katak seed, Chirish, Sindhuvari, and Shleshmat. Right? So, Iti Deshemani, Vishagnani, Bhavanti. So, this can be used in any kind of Dishivish, Garvish, Thavar, or Jangamish, anywhere we can use. And we were having the tablet prepared of Vishagna Mahakachai, and this was also used in the high dose in the initial days. Next. Keshor Gugulu, we know it is a very much famous and indicated in all the Pramepidika and all kind of run where the Kledatva is more there where we need to do the Rukshita of the this thing. So this was used. I think nothing to say more about Keshwar Gugulu, which was very famous Ayurvedic classical Aushadhi. Next. Dushi Visharigulika, this is a very much important drug, and what I feel is all the Ayurveda doctor must have this tablet in his or in her clinic. So, Pipali, Dhanyamlaka, Mamsi, that is Jata Mamsi, Lodra, Ela, Sovarchika, Kuntartam, Natha, Kushka, Yashrimatu, Chandan, and Geri. So it is available and very cheap. It is available. Many pharmacies are preparing it, and we are using in psoriasis, amvata, asthma, or in cancer, in radiation chemotherapy. All these things this can be used, and this is a wonderful gift from Acharya Charaka as well as Vagbata that they have prepared such a good combination, and it is available nowadays to use in our patient. So Dushi Vish, you know the name Dushi means Dushanatiti Dushi. So the wish which is avrut by the cough dosha gets aggravated when there is a cloudy weather is there, rain is there, if person is doing diva sopna, person is having ajirna, all these things, then that kapha avran will be gone and the disease will presented in the it will trouble the patient. Like we see, the many patients get asthma attack when there is a cloudy weather or rain. That is Dushi Vish. Many patients get more stiffness over the joint in the rheumatoid arthritis. That is nothing but the wish, Dushi Vish, right? So any disease which aggravates during the rainy season, we have to use Dushi Vishari Gulika, right? Because that is the lakshan to identify the role of Visha in any disease, with the relation of weather and all these things. Next. Next, sir. Shirisho Vishagnanam, I think we have already discussed this thing. So Dhupan with a Tagar, Pushta and Chirish flower 3 times a day. So Gluta Yukte, Nata Pushte, Bhujagapati Shiraha, Shirisha Pushpam, Dhuma Agada, Smita Yoho, Sarva Vishagnam, Shoyatu Raja. So he Acharya Tarka has given a general Dhupana remedies or the formula which contains very routine drugs, Tagar, Pushta and Shirisha flower. So Tagar is easily available in the market. Pushta, cut, couplet, it is easily available in the market. Shirish flower, if fresh, if we are getting, it is well and good. If not, we can use the powder of the Shirish flower or Shirish Panchanga can be also used. Even though the shloka says we have to use the Pushpa. So the Dhupana or the fumigation with Tagara, Pushta, it in there's a Bhujagapati Shira also he has mentioned. Sorry, I forgot to mention. So Bhujagapati is a snake having the 2 heads or 2 fangs. So the head of that particular snake we have to cut, and I mean we have to use it. We have to put it on the ignited coal along with Tagara, Shirisha and Pushta. So it is practically we cannot search a snake which has 2 heads or 2 fangs, and we have to cut, and otherwise it becomes a problem, you know. I mean कुछ लोग बोलेंगे ये काला जादू कर रहा है तो ऐसा है ना. So we have used the tagara, chiricha flower and the putta only, and by adding ghee on the ganda dhuma this thing cow dung, and we have given the dhupa on the this area. So this is not just for the for spider bite, but he has mentioned Sarva Vishagnaha Swayathu Hatsa. So in all the varieties of wish, it can be used exclusively where there is a edema is more there, right? So this is again the reference from the Chikitsa Sthana, same chapter, 23rd. Next. So based of Rakta Chandan, Shirish Bij, Nilgundi, Vidarikan, Tagar, Pushpa, Patala, Anantamur for oral use and application. Here you can see the Pushpa is repeating, Tagara is repeating, Anantamula, Shirisha, all this, right? So Chandanam Padmako Ushiram, Shirisha, Sindhu Varika, Shira Shukla, Natam, Pushtam, Patala, Uditya, Sariva, शेलु स्वरस पिष्टयोः लुतानां सार्वकार्मिकः यथा योगः प्रयोक्तव्यं समीक्षा आलेपनादिषु, right? So चंदना, पद्मका, उशिरा, शिरीषा, सिंधुवारिका, क्षीरालुसुका, तगर, कुष्ठा, पाटला, उदीच्य, sariv. So all these things has to be made into the paste with the help of Shleshmataka Patra Swaras, and we have to apply it on the spider bite area, right? So this was the again Luta Visha reference. Exclusively, it is mentioned for the Luta Visha application of this lepa, right? We have the in the third line we can read Shelu Swaras Vishtayo Lutanam Sarva Karmika, right? Next. So here you can see the photograph 24 April. You can see the swelling and hardness, redness, vein-like structure. All this thing is visible. Just after 1 day of our treatment, you can see the swelling is little bit reduced, little bit lightness in the redness. All this thing is visible. Pain was not there, fever was reduced, and the area become some little soft in the first visit. I mean, just that is just after 1 day of our medicine use. Next. So the next you can see the inflammation, Utseda and Shirayam and all these things is getting further down. Still little bit of a vein-like appearance is there. And in the last photograph, you can see it is completely clear, right? And now it is more than 2 years, 2.5 years of the treatment of this case, and we have the follow-up of this patient regularly, and he has not faced any problem after taking this medicine. I mean, there is no relapse for the fourth time or nothing. Almost 2.5 or you can say 3 year or 2.5 year, मतलब 3.5 साल के आसपास हो गया, लेकिन अभी तक पेशेंट को अगेन ये रिलैप्स नहीं हुआ है ना. तो आप समझ सकते हैं कि पेशेंट ने 2 बार ऑपरेशन कराया, रिलैप्स हुआ, इतना खर्चा किया, 8-10 दिन छुट्टी लेके धंधे में नुकसान किया, वो अलग है ना. और एकदम कम पैसे में एक आध हफ्ते 10 दिन में एकदम बढ़िया रिजल्ट मिला, और वो भी कैसा कि अभी 2.5 साल होने को है और पेशेंट को रिलैप्स नहीं हुआ है, एकदम क्लियर है, राइट. तो इट लुक्स वेरी इजी. It is very difficult in practice when patient come to us and they say they have history of 2 time operated and all these things, and then we have to give the patients confidence that Ayurveda has enough power, or the Ayurveda has enough potential to treat their illness, because majority of the patient in the community thinks that Ayurveda is for only chronic disease. Ayurveda is for only wellness. With Ayurveda, you can treat only joint pain, constipation, allergy, and all these things. Such condition we cannot treat in Ayurveda. Forget about general public. Even Ayurveda doctor also sometimes thinks that Ayurveda has a limitation and we cannot treat some condition in Ayurveda. Then why would have Acharya Charaka, Sushruta, and Bhagavata has written so many beautifully the emergency and critical cases treatment, right? So that's why I told we must respect our Samhita, we must understand our Samhita, and if we apply practically what is written in the Samhita, it is very easy to deal with any case, right? Next. So again, this was the long follow-up on the 17th May 2023, and the area is completely normal. Next. So this was my presentation regarding the spider bite, how to identify and how this case was successfully treated with all the reference in the book, and no patent medicine were used. I mean, whatever we have used, it is from the Charak Samhita only, right? All the Mahakashaya and all the Lepa, Uppana, Panchashiriski, Shotakna Mahakashaya, all these things. So I put more weight on this specific thing that we must respect our Samhita and Shastra, right? Because thousands of years of human observation and trial and error are always and will be always greater than the current medicine practice, that is the experiments in the lab, right? So again, I thank you very much for listening me, and I again thank the Gurukul Global Academy for inviting me here to share this case. Thank you. Namaste.
Thank you, sir. Thank you. I request all the viewers to please put your questions in the chat box. Okay, sir, we will have the question answer session now.
Yes,
So,
yes, sure.
first question is, sir, Panchashirish Gruth is available in market or not?
No, it is not available. We
Okay.
have we had prepared. I mean, in that time we have prepared.
So,
It is
second
very easy.
question.
Yes.
The second question is, can we apply Dashanga Lep in such cases where unknown bite is means we don't have the bite, whose bite is there, means unknown bite patients, can we apply the Dashanga Lep, such kind of things?
Yes, definitely. The Chang lab can be applied, or you can even apply the Dushi. You can take 4 to 5 tablet of Dushi Vishari Gulika or Vilwadi Gulika, make a paste and apply. And Shirishi Churna simply lap of Shirishi Churna mixed with the Chang lap can be applied. Yes, it can be applied if we don't have this solid evidence that which insect is, I mean, that thing.
Okay. So can we give Tribhuvan Kirti Ras in such patients? That is the one question. Can
I
we give
don't
internal?
think that Tribhuvan Kirtiras will be the good candidate to be used in such case. But if Vaidya's Yukti is saying such thing, so this can be used because everything in Ayurveda depends on the Vaidya's Yukti. So Vaidya is the prime factor who decide the what could be used, what not to be used, irrespective of the what the reference we have. I mean, it is the Vedya's experience. So if somebody has a good experience in treating such condition or some similar condition with Tribhuvan Kirtiras, definitely it can be used. I have treated with this my own youth. Yes.
So next question is, if such patient comes to our OPD where bite is unknown, means in unknown bite case presentation, what would be the basic principles of Ayurveda we should follow before giving the treatment?
Uh, Generally, if we ask patient or if we take a detailed history, some of the patient will say that they have this thing. Or if they don't have a specific history or they don't remember anything. So I told you the one of the cardinal lakshan of a Visha is person won't be having anything the day or the time when the cloud is getting gathered or the rain is there, suddenly the disease will start showing the presentation. So all these disease can be, we can diagnose it as a Visha. So asthma is also pranava sulta swadi, like I already gave you the example. So in the asthma also we have to do Visha Chikitsa because this increase with the rainy atmosphere and all these things. So any disease. So like that you can diagnose. And nowadays we all see the insect bite cases in our OPD in daily. How? We see the dengue, we see the malaria. So what is malaria? It is the it is the this thing, kit witch, right? The mosquito is biting. It is releasing the specific kind of toxin into the blood, and it is causing all the fever that they say plasmodium falciparum or vivax, all these things. Dengue also. So recently we have treated one 6 or 7 year girl who she was having the dengue hemorrhagic fever, and we have treated it with the Chirichiturna, Duchivichari, Gulika, and all these things, right? So if we have a diagnosed case of malaria and dengue, we can directly initiate the treatment of Duchivish or the Garvish or any Vishachikitsa.
Thank you, sir, for your expert, insightful thoughts. Let me introduce our guest of honor, Dr. Priti Lohe Wanjari, madam. Madam is B.A.M.S from Sri Ayurved College. Madam has done MD Agad Tantra from Datta Meghe University. Currently, Madam pursuing PhD in Agad Tantra. Madam is Associate Professor in Department of Agad Tantra in Mahatma Gandhi Ayurved College, Wardha. Madam has published 10 plus research papers, and Madam has a keen interest in preventive cardiology. I invite Dr. Priti Lohe, Madam. Madam, please give us your expert views on this.
Thank you, sir.
Namaste, madam.
Namaste. Thank you, sir, for welcoming me. And I will congratulate Dr. Rajnikant, sir, for a great case presentation, and for Gurukul Academy that you are providing. So good platform for the newcomer student. And as per Agad Tantra, as my specialty is on PG and my PhD is pursuing on Agad Tantra. As Agad Tantra in UG level, we just uh, read and give the exam. When we give specialization, just nowadays, so we are exposing to Dushivi's concept and Garavi's concept in day to day life. There are the many diseases. This is are as explained. Asthma hai, occupational disorders are there where the dust and allergic diseases are more to we are prone to. Even Garavisha concept where we are taking a adulteration in the food, or any a bad habit or jo lifestyle disorder, they are also a type of a Garavisha concept we can include in that. So Agat Tantra is not only the Visha Tantra as per के only poisonous treatment we can done, but nowadays जैसे सर ने कहा कि मलेरिया है या डेंगू है, these are also kitvish, which are the vast concept in the Agat Tantra. So we have very much scope nowadays for use of the Agat Tantra in day-to-day practice. जैसे Dushi Vishari Gulika is the best. My thesis topic was in MD was Dushi Vishari Gulika for urticaria, skin disorders. So even as a Deepan Pachan, we can use a Dushi Vishari. क्योंकि in a day-to-day life we are exposing too much poison directly, indirectly, like a slow level or small doses of the poison. So Rajnikant sir have taken a vast concept, and this is like this is a spider. The patient was suffering since a long, and to take this thing, I congratulate sir. Sir, may I have a question, please? Can we use Rakta Mokshan in that case?
Rakta Mokshan, I think yes, it can be used because what the literature says is in the all the kind of Visha, we have to focus mainly on the Pitta, right?
Yes.
So definitely we can do. But the
Yeah.
problem was in this case was the area where he was presented was very much hard. It is like if you do like this, you will get little voice. I mean, so it is
Yes.
very difficult. But definitely from distal area or the jugular also we can puncture it. It can be,
Yeah,
yes.
or we can use Jaloka for the look when there is
Yes.
a cyst
No,
formation is there.
Jaloka, I think not advisable because we already had the evidence of abscess formation and all this thing is already there, right? And
Yes, sir.
he was already operated for 2 times and it is now here and we were not I mean मतलब रिस्क लेने में काफी वो दिक्कत था क्योंकि इधर से आगे कहीं गया तो हमको मालूम नहीं पेशेंट
Yes,
एक्चुअली डरा तभी वो इधर आया कि 2 बार
yes,
हो
sir.
चुका है तो इधर से अब आगे कहाँ जाएगा ये है ना
Yes,
तो
sir.
कहने का मतलब वो लोग जो ट्रीटमेंट कर रहे थे वो व्याधि विपरीत चिकित्सा था मतलब जो उनको दिख रहा था उसको कट करके निकाल दिया बात खत्म लेकिन
Yes,
प्रकृति स्थापन जब तक नहीं होगा जब तक विष का मारण वो एरिया से नहीं होगा तब तक तो वो वापिस आता रहेगा जब उसको अनुकूल निदान का वो मिलेगा तो वो वापिस रिलैप्स
yes, sir.
होगा है ना
Yes, sir.
यस
So, sir, that's good. So, the Shivishari Gulika can be extended up to 2 or 3 months. That is, the leftover poison can be eliminated from total body.
यस यस इट कैन बी गिवन
Yes. So, just the Dushivishari Gulika or Champak Agad are there, or Kitvish we can use, and the Panchashirish Agad and Pinchashirish Guru. These are the medicine we can use in day-to-day practice. And so, Rajnikant sir has proved it in a good, well treated patient. So, I will congratulate sir and Gurukul Academy, and thank you for giving me a
थैंक
guest of honor for this case presentation. Thank you, sir.
यू
Sir, one more question. Which pharmacy provides the Dushe Vishari Agat?
it is very common Vaidyaratnam is there Sitaram is preparing Vaidyaratnam you can get Sitaram also preparing
Sir, one more question. Can we use Shodhan Upakram as you said about Siravedan and Jaloka? The same question, can we use the Shodhan Upakram? I think it is related with
Shodhan
Vaman or Virechan.
no, not. It cannot be done. I mean, I would not advise because this is a critical condition where patient came, and if we don't give them a result in within 24 or 48 or 72 hours, either patient will go to the surgery or मतलब अपना नाम खराब होगा. तो आयुर्वेद में ऐसा भी लिखा है कि हमको ऐसा ट्रीटमेंट नहीं करना चाहिए कि हमारे ट्रीटमेंट से पेशेंट का दिक्कत बढ़े या तो पेशेंट हमको पता था कि हमसे नहीं होगा और हम करेंगे तो हम अच्छे वैद्य की कैटेगरी में नहीं है ना। तो ये भी चीज को हमको ध्यान में रखना है केस, स्पेशली ऐसे केसेस में जहाँ 1 2 3 4 दिन में फैसला हो सकता है कुछ भी, है ना। तो वहां पे हमको कैलकुलेटेड स्टेप लेना पड़ता है। तो आई थिंक नॉट एडवाइजेबल अकॉर्डिंग टू मी।
Okay, thank you, Rajnikant sir, and thank you, Priti madam, for your insightful thoughts. Now we are moving towards vote of thanks. I request Dr. Om, over to you, sir.
Thank you, sir. Good evening, everyone. I am Dr. Om Dattatreya, MD Panchakarma, and a core team member of Gurukul Global Academy. As a core team member and on behalf of the Gurukul Global Academy and Parasna Spiritual Foundation, I am truly honored to deliver this vote of thanks. I sincerely thanks to all who have made today's session special and memorable. First of all, heartfelt thanks to esteemed guest of honor, Dr. Priti Lohe Wanjari ma'am, for gracing our event and sharing your inspiring thoughts. A special thanks to our guest speaker, Dr. Rajnikant Patel sir, for their expertise here and dedication to promoting holistic well-being through Ayurveda. We truly appreciate and acknowledge our medical expertise, compassionate care, and unique perspective of Ayurvedic approach towards treating such medical conditions. Your insights have significantly broadened our perspective. Special thanks to Aryaved Kalpashala, and very special thanks to participant connected here with us. Also, we are immensely grateful to Dr. Balchandra Mahamuni sir, founder Parasna Specialty Clinics, for giving us opportunity by building such a unique platform. Special thanks to our in charge of the Gurukul Global Academy, Dr. Datta Babardikar sir, for their constant support and guidance. Thanks to Dr. Anushri ma'am for wonderful introductory session. At last, I would like to thank our support team, tech team, and everyone involved in the planning and execution of this event for making this event seamlessly successful. Thank you very much. And also, we request you all to stay connected in the WhatsApp group through email and social media so as to get the links of upcoming super specialty meetings. Thank you so much.
Before ending up, I would like to give you the brief about our next clinical meeting would be on Dharmantari Jayanti, that is 18th of October. Our guest speaker would be Dr. Nitin Kochar sir, and the topic would be evidence-based management of cancer by Ayurveda. So be connected with us through social media, WhatsApp, Facebook, LinkedIn, and our website. Thank you. I conclude. Thank you.